She walked into the hospital like any other patient. Quiet, tired, slightly hunched over. Her only complaint? A dull stomach ache that had been bothering her for a few weeks. At first, the doctors didn't think much of it. After all, stomach pain is common in older adults, often caused by constipation, gas, or indigestion. But something didn't feel right. Her eyes were alert, but her body looked fatigued, and she kept clutching her side with a subtle wince. As she lay on the hospital bed, nurses began the routine checks. Blood pressure, a little high. Pulse, slightly irregular. Then came the abdominal scan. That's when everything changed. Within moments of the scan starting, the technician froze. "Doctor, you need to see this," she whispered. The doctor rushed in, and what they saw made everyone stop in their tracks. Something foreign was sitting in her stomach, something that had no business being there, something that could have ended her life if it had stayed any longer. Now, before we reveal exactly what they found, let's pause, because this isn't just a story about one woman. This could happen to anyone over the age of 60, maybe even someone you love, maybe even you. As we age, the body sends out silent signals, little warnings, but they're easy to miss. And when we ignore them, they can grow into life-threatening problems without warning. Today's video will walk you through what doctors discovered inside her body, how it got there, the 5 shocking things often found in senior stomachs, why older adults are more vulnerable to this, and finally, how to protect yourself and your loved ones from this hidden danger. This story is more than just shocking. It's life-saving, so please watch until the end. Your health is sacred and your body deserves attention, not silence. The shocking discovery. So what did doctors find? Inside her stomach was a large, compact mass of hair, a trichobezoar. Yes, you heard that right. A tightly packed ball of hair, roughly the size of a grapefruit. Now, you might be wondering, how does a person end up with hair in their stomach? It turns out this elderly woman had a condition known as trichophagia, an unconscious or compulsive habit of eating one's own hair. It often develops in people with anxiety, dementia, or obsessive-compulsive tendencies. In younger people, it can be caught early, but in seniors it's often missed, especially if they live alone or if their family isn't paying close attention. Over time, the hair can't be digested. It collects, it compacts, and it forms what's called a bezoar, a hardened lump that blocks the digestive system. Her symptoms were mild at first: stomach discomfort, occasional nausea, loss of appetite. But by the time she came to the hospital, the mass had grown so large that it was interfering with her ability to eat, digest, and absorb nutrients. What's more frightening, these masses can sometimes lead to ulcers, internal bleeding, or bowel obstruction. In rare cases, they can even cause sudden death during sleep if the blockage interferes with the vagus nerve, which affects heart rate and digestion. The doctors immediately scheduled surgery. Thankfully, it was successful, and she recovered. But they were still stunned. A hairball of this size in a 78-year-old woman? It was both rare and dangerous. Afterward, her family revealed that she had been acting a little off for months. Unusually quiet, withdrawn, and constantly playing with her hair. No one had connected the dots. And that's the key point here. Many health issues in seniors go unnoticed because the symptoms are silent, subtle, or mistaken for normal aging. This woman was lucky, but many are not. Let's now explore how something like this can happen without warning, and what signs we need to watch for, especially after age 60.3. How it happened. Silent symptoms. Seniors ignore what is terrifying is how slowly and silently this condition built up. She didn't wake up one day with a giant hairball in her stomach. It happened over months, even years. And all along, her body was giving her quiet clues, whispers that something was wrong. But those whispers were easy to ignore. Let's break down the common but often overlooked symptoms that many seniors experience. mild stomach pain. Seniors often dismiss this as gas or indigestion, but if the pain persists or worsens over time, it could signal a blockage or internal buildup. Loss of appetite. If a senior suddenly eats less or avoids food altogether, don't just assume it's due to aging. It could be a sign of something physically blocking the digestive system. Weight loss without trying. This is one of the biggest red flags. If someone over 60 loses weight rapidly without changing their diet or activity, it's time to see a doctor. Nausea or vomiting, especially if it occurs after eating, this suggests that the stomach is having trouble moving food along. Fatigue or weakness. Malabsorption caused by a blockage can deprive the body of essential nutrients, leading to tiredness, weakness, and even confusion. Strange behaviors, like hair pulling, chewing on odd things, or repetitive motions. These can point to underlying emotional or cognitive issues that may lead to habits like trichophagia. Why do these symptoms get ignored? Because many seniors assume it's just part of getting old. Because families may not notice subtle changes, especially if they don't live nearby. Because doctors may overlook these issues unless the patient is very vocal or insistent. That's why education and awareness are so important. As we get older, we must learn to listen to our bodies and take even small changes seriously. And if you're a caregiver or have an elderly parent, be attentive to their habits, routines, and complaints. Sometimes what seems minor could be the tip of a much larger issue. Now let's look at the broader picture. What other dangerous objects or substances have doctors discovered in senior stomachs? And why? The 5 dangerous things commonly found in senior stomachs. While the hairball story is shocking, it's not the only strange thing doctors have discovered. Let's look at 5 dangerous and surprisingly common things that have been found in senior stomachs and why they matter. Undigested pills or capsules. As we age, the stomach produces less acid and the gut slows down. Some medications, especially coated pills, don't dissolve properly. They can sit in the stomach, clump together, and cause discomfort or even internal damage. In some cases, pills have been found stuck together, forming pill bezoars. This is especially common in seniors taking multiple medications. Dental devices or dentures. Yes, dentures. Some seniors accidentally swallow partial dentures or dental bridges during sleep or meals. These hard objects can block or puncture the digestive tract, and in rare cases they remain unnoticed for weeks until they cause pain or infection. Food that hardens into stone-like masses. Some foods, especially persimmons, pumpkin, or fibrous vegetables, can form a mass called a phytobezoar in the stomach. This is more common in seniors who don't chew food well or have low stomach acid. These masses block digestion and may require endoscopic removal. Hair or fiber buildup. As we saw in today's main story, hair can accumulate, but so can fibers from blankets, rugs, or even clothes. Seniors with dementia may chew on fabrics, unknowingly swallowing fibers that build up over time. Parasites or infections. While less common in developed countries, some seniors who travel or eat contaminated food may develop stomach parasites. These can go undiagnosed for months, causing bloating, pain, diarrhea, or anemia. All these objects or organisms disrupt digestion, but more importantly, they often go unnoticed for far too long. Symptoms like unexplained weight loss, bloating, constipation, or pain can easily be dismissed. That's why it's so important for seniors and those who care for them to stay alert. Next, let's look at why seniors are especially vulnerable to these digestive dangers in the first place. Why seniors are at higher risk as the body ages. Many internal systems begin to slow down. This includes the gastrointestinal tract, which is responsible for digestion, absorption, and waste removal. Here are several reasons seniors are more likely to experience these kinds of stomach issues. Slower digestion. The muscles that move food through the digestive system weaken with age. This can lead to slower emptying of the stomach and increased chances of blockages or buildup. Reduced stomach acid. Older adults often produce less stomach acid. This means food and medication aren't broken down properly, increasing the risk of bezoars or pill clumping. Polypharmacy, taking too many medications. Many seniors take 5 or more medications daily. This increases the risk of side effects, drug interactions, and undissolved pills sitting in the stomach. Memory loss or dementia. Seniors with cognitive decline may forget they've already taken a pill and take another, or they may accidentally ingest non-food objects. Dental issues. Difficulty chewing can lead to swallowing larger pieces of food, increasing the risk of blockage. Loose dentures can also be swallowed accidentally. Emotional health depression or loneliness can lead to strange eating habits like chewing hair, eating less, or overusing medication. 7. Dehydration and low fiber. Without enough water and fiber, digestion becomes sluggish. This leads to constipation and makes it easier for blockages to form. So while younger adults may recover quickly from minor stomach issues, seniors are at much higher risk of serious complications. The good news? With a few daily habits and preventive steps, most of these dangers can be avoided or caught early. Let's look at how. Prevention tips for seniors and caregivers. Here are some powerful, practical steps seniors and caregivers can take to protect against digestive blockages and foreign object risks. Eat slowly and chew well. Seniors should take time to chew food thoroughly, especially tougher meats or vegetables. This aids digestion and reduces the risk of bezoar formation. Avoid high-risk foods. Limit foods known to harden in the stomach, like persimmons, pumpkin seeds, or very fibrous vegetables if chewing is difficult. Take pills with plenty of water. Always drink a full glass of water with medications. Avoid lying down immediately afterward. Use pill organizers. These help prevent double dosing or forgetting medication. Caregivers should check weekly pill boxes if memory issues are suspected. Monitor denture fit. Have dentures checked regularly. Remove them at night. Watch for signs of loose dental devices that could slip during meals. Encourage daily bowel movements. Constipation increases risk of bezoars. Drink plenty of water. Eat fruits like prunes or papaya, and walk daily if possible. Watch for behavioral changes. If a loved one begins chewing on hair, fabrics, or showing obsessive behavior, consult a doctor, especially if they have dementia. Avoid excessive medication use. Don't take extra pills for minor discomfort unless prescribed. Talk to your doctor about simplifying your medication plan. Regular checkups. Encourage annual checkups that include blood work and a discussion about digestion and diet. 10. Caregivers, stay observant. Look out for weight loss, behavioral changes, eating problems, or odd complaints like feeling full all the time. Most importantly, remind yourself and your loved ones, your body deserves peace, not pressure. Your stomach deserves comfort, not confusion. Good digestion is one of the foundations of long life. Let's honor it. 7. The woman's recovery. And what we can learn after the surgery. Doctors carefully monitored her recovery. Her appetite slowly returned. The pain disappeared, and best of all, her energy came back. Her family, filled with guilt and gratitude, committed to being more involved. They spoke with her doctors, adjusted her diet, helped organize her medication, and scheduled therapy to address her anxiety. One of her granddaughters even moved in to care for her more closely. The most beautiful part? This experience didn't just save her life, it brought her family closer. It opened everyone's eyes to the quiet struggles many seniors face. The ones they're too proud to mention, or too afraid to burden others with. We all age differently, but one thing is certain, the body always tries to speak to us, through symptoms, through feelings, through energy. Let's not wait for a shocking hospital visit to start listening. This story is a wake-up call, and a gentle reminder that our elders know and our own aging bodies deserve patience, attention, and love. Today, we explored a shocking story, but behind the shock lies something deeper, a truth we all must face. Aging is not the enemy. Silence is. When our bodies speak, we must listen. That elderly woman could have died. But she didn't because her body kept sending signals. And finally, someone paid attention. Let this be your reminder to take stomach pain seriously, avoid assuming everything is just old age, stay involved with your loved one's health, and most of all, never stop learning about how your body works. If you're a senior, your life is sacred, your health is precious, and your voice matters. And if you're a caregiver, child, or friend to an elder, your awareness could be the key to saving a life. Please, if this video helped you, share it with someone who needs to hear it. Like the video, subscribe for more senior health wisdom, and comment below, "My body deserves peace." Because it does. Thank you for watching. Stay safe, stay aware, and remember, even the smallest symptom can carry the loudest message.